Hello, I'm going to do a few signs today in relation for how you can communicate with your patients in a chiropractic office if they're hard of hearing or deaf. So the first thing you want to do is you would just say hello. It should be the easiest way of saying hello. Then you can ask if they're deaf. So you, deaf, so you're touching your ear and your mouth. You deaf, you, and then this, a lot of times you use this as a question. You would raise your eyebrows as well. So it'd be you, deaf, you, and then you can say you understand sign, or you want, this is a sign for want to sign, or you can ask them want right back and forth. Because not every deaf person will understand sign, or they may not prefer to use sign. So then you can say, okay, so I am a chiropractor, so CHIROPRACTOR, that's a doctor. This should be the sign for doctor, if you can see it here. Okay. Or you can do, sometimes they use D. D is for doctor. And so I work on the spine and the back and the bones. Okay, so this is sign for bones. So any of those would work just for introducing yourself and explaining who you are. And then you can say my name, and then you'd finger spell. This is sign for finger spell your name. So in my case is Dr. Beck, B-E-C-K. And then you just kind of go in there. If you want to do the medical history, and this is the sign for medicine. So if you can see this, take your middle finger here, do medicine, and then you can do sign history, or you can do, this is the H, and do it twice. That's also history. So you can ask them a few questions. So you say like medicine you take, or medicine you use. That can be an introductory question that you do, and then a few other ones. You might want to ask them like, okay, so what is your problem? This is the sign for problem. So what is your problem? Or you can say where, if this is a sign for pain, where pain. And they, a lot of times, will just sign where the problem is. So if they have a headache, they would sign pain over their head, or pain over their chest or back or wherever. So those are just some answers you might get. If you're asking a yes or no question, they can say yes, or they can say no. There's two possible responses. They might say okay. They could say they're fine. So you could ask them, how are you? And they would say fine. Or you could ask them, how are you feeling? So basically you take your middle finger and just touch your chest like this. How are you feeling? Remember, everything with a question, eyebrows up. Unless you're doing a WH question, or where, what, who, when, what is your problem? So I'm going to shift my glasses down here. So you bring your eyebrows down in that case. Or where is pain? What problem? Those are all eyebrows down. So those are just a few things that you can ask, and to get you started. I don't want to get this too long. I'll just do one more, and that you can ask for blood pressure. So this is the sign for blood. Okay, blood and pressure. Pressure. So if you suspect that someone might have, issue with high blood pressure, you could say blood pressure tend to be high. So high like this. That would be another question, and of course I can always say yes or no, maybe, I don't know, maybe kind of thing. So those are just some questions. Now, if you want to, and I'll do another video on this too, but once you're ready to adjust them, then you can tell them to lie down. So just bring your hand up, 2 fingers, lie down. So you could do this way, or you could do this way. And if you want them to turn over, you just say roll over. That should be the sign for roll over. If you need them to sit up, you're actually mimicking helping somebody up to basically sit up. So those are just some ways that you can help communicate. Remember that you always want to look at them directly, make sure they can see your lips. Some deaf people do read lips in addition to signs. Some use it more, especially if they're hard of hearing and they can understand a little bit. They may use lip reading to help them. So make sure you face them, speak clearly, make sure they can see your lips. Don't turn your head and start talking. That's going to be very difficult for them. So I hope this helped you, and thank you, and I will see all of you later.